Hi everyone, this is Dr. Olivia Bevera, and today we will be talking about dental pain in kids. Now, tooth pain comes in many forms. It can be persistent or just periodic. It can be severe or mild. It can occur spontaneously or in response to a certain stimuli. Regardless of the tooth pain, the best way to help is to visit a pediatric dentist. Toothaches are typically a sign that your child is suffering from a dental infection or suffering from a dental trauma. Making an appointment with your child's pediatric dentist ensure that the child receives timely treatment. Now, what causes toothaches in children? Toothaches in children usually occur because of damaged or exposed dentine or dental pulp. The crown of a child's tooth, that is, the visible part of the tooth, consists of three layers. The outermost layer being enamel, the layer adjacent to the enamel is dentine, and the innermost core of the tooth called dental pulp. The dentine is a hard porous substance, whereas the dental pulp contains nerve endings and blood supply. This zone is also called as the nutrient-rich zone. The dentine of the tooth contains tiny tubes that connect the dental enamel to the inner dental pulp. Hence, when a tooth loses enamel, this dentine gets exposed to the external environment. This exposed dentine, when comes in contact with hot, cold or acidic substances, tends to irritate the dental pulp and stimulate the nerve endings in the pulp. This ultimately results in tooth pain and sensitivity. If the nerve-filled dental pulp becomes damaged severely, this leads to severe and persistent pain in children. Thus, the type of tooth pain a child experiences depends on the cause of this pain. There are different types of pain which a child experiences. The first is persistent throbbing kind of pain without any identifiable trigger. When we see children with persistent throbbing kind of pain, which prevents the child from sleeping at night, such kind of pain is generally due to inflamed dental pulp or an abscess that is present. A tooth abscess is built up of pus in a particular tooth in response to infection in that tooth. Deep cavities, gum diseases, and dental trauma can also lead to the inflammation of dental pulp, thus leading to persistent throbbing pain in children. Treatment of the underlying infection is very important to stop the condition from worsening or immediate relief from pain for the kids. The second type of pain is constant dull aching pain in the tooth or jaw. The most common cause for such kind of pain that we see in children is due to some kind of gum disease or an impacted wisdom tooth. Impacted wisdom tooth is that tooth which do not have sufficient space to erupt normally. In this kind of pain, treatment of the underlying condition is necessary to help prevent worsening of the disease or to provide instant relief. The third type of pain that we come across in kids is pain on consumption of hot, cold, sugary or acidic foods. When children experience this kind of pain, it is normally due to a dental caries present in the tooth or due to some dental trauma. Both dental decay and dental injuries can damage your kid's tooth and make the dentine exposed. The last type of pain is sharp stubbing pain on clenching of the mouth. This type of pain is generally a result of a cracked tooth. When a child's tooth is cracked and the child clenches or chews on this tooth, this results in the opening of the crack. When the child releases the bite, this crack is closed. When the child releases a bite, it feels a sharp pain. This is due to the fast closure of the crack. Interestingly, the pain from a cracked tooth can be inconsistent. Hence, a child may only feel pain when he clenches or chews on something in a particular way. Hence, it can be sometimes difficult for a child to pinpoint where exactly or which tooth exactly is hurting.